Hi, welcome to our presentation. It's over temporal ordering and sequencing. So the definition of temporal ordering and sequencing is when the brain processes not only two or more sounds at one time, but it also sequences those sounds in a certain order. First, I'm going to talk about the tests that we will be outlining in this presentation. The first one is the duration pattern test, or the DPT. It's also known as the duration pattern sequencing test. The second is the frequency patterning test, the FPT, also known as the FPT/S, the acoustic contour, and pattern recognition. So some of the auditory skills tested in these tests are pitch discrimination, timing or temporal processing, and ordering and sequencing. So I'm going to talk a little bit about auditory pattern recognition. So this is a process in the brain, and it helps us analyze acoustic events over time. So like speech or music or something like that. It is fundamental to speech understanding because we need to our brain needs to be able to put words in a certain order to make sense out of the message. So ordering of phonemes or words for comprehension. It also helps us understand the linguistic content of the message and also the communicative intent of the speaker or the source. And it is heavily reliant on the interaction between hemispheres via the corpus callosum. So now I'm going to keep talking about the corpus callosum a little bit and some of these anatomical sites. So the temporal lobes and the corpus callosum are fundamental for this process. If there is a lesion in either temporal lobes, left or right hemisphere, or the corpus callosum, we can't be processing the ordering or the sequencing of the acoustic signal. So I'm going to talk a little bit about the history of the DPS. Dr. Frank Musiak actually created his own DPS test. It's called Musiak DPS, and on this slide we have a picture of it up here, sorry, zoom. And the test is really old, not really old, but fairly older. It's over 25 years old, and Dr. Frank Musiak also worked on the FPT test as well.
When we're talking about the duration pattern test, also known as the duration pattern sequence, it's important to note that it's similar to the FPT, the frequency pattern test. And this is a test of APD for ages generally 7 to 11. It uses nonverbal stimuli. It is a temporal test. And it actually uses something called auditory pattern temporal ordering, known as APTO. And most importantly, it is sensitive to cerebral lesions. Something to note about this test that's interesting is that musicians often do much better than non-musicians. The stimuli for this test are 3 1000 hertz tones. You have 2 of the same duration in each trial. You're going to have a 500 millisecond one and a 200 millisecond one. And then you're going to have an interval of 300 milliseconds between the tones, just so that you can differentiate. And you're going to have a 10 millisecond rise or fall. And then this test can actually be done with verbal replay instead. And then just to note, on the side, the picture is taken from Frank Musiak's study on the DPT, and it's just showing the stimuli. The setup on the audiometer for the DPT is that you start at 55 dB bilaterally. You're going to have channel 1 set to source A or source B, and your instructions are going to be this. You're going to hear 3 tones. Some will be short and some will be long. I just need you to tell me the pattern that you hear. Then you're going to provide an example and you're going to complete 3 practice problems with your patient. This actually has 6 possible combinations of the patterns, which is shown below. Long, short, short, long, short, long, long, short, 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 long, long, or short, long, short. When you're scoring the DPT, it's actually very similar again to scoring the FPT that we'll talk about later. And you're just going to be scoring the percent correct. You're going to want to note if they have a reversal. So instead of doing long, short, short, if they did short, short, long, and you're going to want to note what they did differently if they just got it wrong overall. The DBT is more resistant to hearing loss because we present it at a super threshold level. The test norms for the duration pattern test are shown below, primarily for ages 7 through 11, and you can see the scores on the right-hand side, and then there is a 73% normal score for ages 12 and up. As far as abnormalities with the DPT, if an individual is showing abnormalities here, this means that there's going to be a problem with that individual's cortex. Now we're moving on to the history of the frequency pattern test. This was developed by Dr. Frank Musiak. He studied different CD versions of frequency and duration pattern tests on normal hearing adults, and what he found was that his results were revealing normal hearing adults performing approximately 90%. The benefits of this test is that there are high accuracy and it's easy to perform.
So the frequency pattern test, also called the pitch pattern sequence, is used to assess the auditory process of temporal patterning and interhemispheric transfer via the corpus callosum. It is normalized for patients ages 8 and above. The stimuli used for this test is nonverbal, which is a benefit for patients whose native language is not English. So what we use are 3 200 milliseconds tone bursts at either high or low pitches. The frequencies that we use are 880 and 1122 hertz. The reason that we choose these two specific frequencies is because they have the same level, so equal loudness on the phone curves. The way we set it up on the audiometer is we're going to set the intensity at 55 dB SL in both ears. So they're going to be hearing this test dichotically through both ears at the same time. We're going to set channel 1 at either source A or source B. For the instructions, you're going to say, do you know how to hum? Show me. I want you to hum back what you hear. For example, if you hear bum, 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 and then you can also try to show them with your hand gestures the high and low pitches. Then you're going to proceed and do at least 3 practice items. And then you're going to say, now you are going to tell me if the tones are high or low. You can use the terms up and down for younger kids. For example, if you hear bum, 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 you will say high, high, low. And so then you can give another example and make them repeat, tell you what the pattern was so you can make sure that they got the instructions right. So for the scoring of the FPT, you're also going to be counting the percent correct. So since there's 2 parts to it, you're gonna do the first part with 10 humming, and then the rest are 20 labeling. If they get the first 10 correct, then you can stop the test. For the test norms, so you're gonna look at the age and then choose the column, whether you're looking at the labeling or the humming section that you did, and then look at the percentage correct based on their age. The abnormalities for this test, so there are 3 things that they can do wrong. They can either reverse the pattern, They can add extra elements to the pattern, or they can use supplements such as tapping their foot on the ground or using hand gestures to make the test easier for them. So if they have a right hemisphere lesion, they're going to be having an abnormal function in both ears. So even if they're not symmetrical, they're both going to be abnormal. If they have a corpus callosum lesion, then the labeling part of this test is going to be abnormal in both ears. And the humming will be either normal, or if it's not, then it's going to be better than the labeling. And if they have a left hemisphere lesion, then the labeling is also going to be affected. And again, the humming score will be better. So for the APD profiles, abnormalities reveal a prosodic deficit in these patients. So they're going to be having poor temporal patterning performance, so both for the humming and the labeling on the FPT test. They're also going to have trouble with performing pitch discrimination. And when it comes to dichotic tests, they may present a left ear weakness.
Here are our references. All right, thank you.